It does. I mean, so I would say that it depends on the study. Um, Studies where they're, quite frankly, some of the studies that we're so excited about with some of these new medications have been relatively difficult to enroll for because they are brand new therapies for which we have no long-term safety data, and a lot of parents are reluctant to put their child in a trial. Um, with very good reason, right? If, in particularly, if you say, well, if I give my child a vitamin for 3 months, they are likely to get benefit, then why do I necessarily need to expose them to the risks of a brand new unproven therapy? And so in many cases, the patients who are coming to me saying, can I please be in a trial, are those who have continuous headache, who have failed multiple therapies, who are therefore ineligible for the trials. And so I do think that that is a mismatch, right? And I understand why the trials are designed to say, let's address regular, sort of more straightforward earlier on migraine. Because if, as has been the case with the adult studies, they can demonstrate benefit with low risk of side effects, then that would be potentially superior to what we have available, right? Again, the CHAMP study showed that there were a lot of side effects in those meds, particularly topiramate. And so if we have another therapy that does ultimately have long-term safety, that has fewer side effects, that's easier in terms of adherence, maybe then the prescription patterns will eventually shift. But for right now, early on, when these meds have only been approved in adults for a couple of years, it's hard sometimes for parents to say, I want to put my child in that study. And so I think that that's something that we just wrestle with, right? And it depends. So sometimes it's patients who are more refractory, but might just sort of been able to eke in and into those studies, that those are happy to do it. Or sometimes it's like a child where the parent has tried a specific therapy and found it really beneficial, that they want to participate. So those are sometimes what we're seeing. I think there have been a couple of things. So one, in migraine in general, I think that we, particularly early on, when we had the shutdown period and we couldn't do our usual procedures, and we couldn't have in-person clinics as easily and things like that, a group of us got together and wrote a paper essentially describing, other alternative options, and they were clearly off label, and we stated them as such, right? And we essentially, gave the evidence where it was, but it was very limited, and said, here are some things you might try orally for status migrainosus if you can't bring a patient in to do IV meds or a nerve block or something like that. And I found that really interesting because in some ways it was one of the best received papers I've ever written, even though it had the least data behind it, right? It was like, here's what you can try in real world care if you are getting stuck, because it's the sort of tips and tricks that people sort of whisper down the lane, but can't publish because they didn't have enough data. And suddenly we were like, well, here it is, right? Here are the tricks, because we got to all help each other. And interestingly, even in those cases, sometimes like insurance was allowing us to use, for example, some of the new medications off label for older teenagers more easily than they had otherwise, which quite frankly was the request of the paper to the insurers, was please give us flexibility. We're both hands are tied. We can't do anything right now that we would usually, or we can't do many things we would usually do. We need a little bit of flexibility. And so that was really helpful to actually have that flexibility. And some of it's been maintained, some of it's been pulled back, but sometimes, we will say, hey, we started this med a couple of years ago. It's really helped. Let's continue. The other sort of piece that jumps to mind is, honestly, I would say it's almost like a humility. I think we had, in general, I think the philosophy for the majority of us was that we needed to focus on school and we needed to get children to go to school. And there was sort of a very, I think when I'm speaking in generally, right? Because definitely people had different opinions before COVID, but to some degree, there was a lot of rigidity of, in-person school is the norm, and therefore we must get you to in-person school, and we must figure out how to do that. And then COVID changed everything. And there were some kids who did so much better when they weren't in person school. And some of them, it's because they were, quite frankly, shy, and they did better when they didn't have to necessarily interact with a huge group. Some of them, maybe it was the lights and the noise and all of those other things that they would come to us and say, this school building is really hard for me because of all these things. And so there were a good chunk of patients who got much better when they were home. And so now it's important for us to reflect and say, okay, maybe we don't need to think about this as a one size fits all, right? And so whereas I used to think of cyber school as not a great option for patients, I'm a little bit more forgiving about the concept now. Well, maybe it is a good option for you. And I'm always very careful to say, it still wants you to make sure that you're maintaining a good schedule, you know, you're sleeping and you're eating and you're doing all those things, and that you're socializing, right? And you're exercising. Because if you're not leaving your house and you're not seeing friends, and that's not good for your development overall. But if we can make sure we bring in the positives and don't just restrict, you know, sort of to all, you know, all the negatives, then maybe it, you know, we need to think more broadly. And so I do think that, you know, if you look at the rates of kids enrolling in things like cyber school, I think it certainly has gone up over the past year. And so, you know, I'm curious to see how that plays out over the next several years.